Hello, Brandon Rogers and Trent Bradshaw with Bradshaw Financial Planning and Mind Your Money. Today we've got a really important topic we want to cover in regards to Medicare. We've got Anna and Amanda with the SHIIP program out of the Rufty Holmes Senior Center that's really going to, really dive into this topic, give a lot of good guidance, and have a really great presentation today.
Well, like Brandon said, this can be a confusing topic. And if you have any questions for Anna or Amanda, let us know. You can shoot us an email or give us a call, and we'll be glad to get that over to them and get you some answers. Hope you enjoyed the presentation.
All right, well, welcome guys. My name is Anna Herrera Turpin. I am the new Aging Transitions Manager here at Rufty Holmes Senior Center. I oversee the SHIIP program, and I am the SHIIP coordinator for this county. And if any senior wants to come and make appointments with counselors, with our SHIIP counselors who are volunteers, they can call me and set up appointments with them. And what they do, they just go over Medicare and just kind of inform them about their options. And so open enrollment starts October 15th through December 7th. And that's the time that counselors can meet with individuals and help them navigate Medicare.
Okay. And I'm Amanda Black. Hi, guys. I've been a volunteer with the North Carolina Department of Insurance for, I think it's been 7 years, but time flies by when we're having fun. So, but we actually just celebrated a birthday with North Carolina Department of Insurance. They're now 34 years old. But we were kind of one of our first of our kind in the United States. The goal of the North Carolina Department of Insurance, obviously it's a state agency, and their goal is to be neutral, objective, unbiased about information, anything Medicare related, as well as long-term care insurance. And so we were kind of one of the first of its kind, because in 1992 is when we got the big rules from the government to say that each state should have a SHIIP type agency. Now they call them all kinds of different names, but ours is called SHIIP with, and then like, for instance, Florida's SHINE. So you may hear it from different things, but if you have someone from a different state, we can certainly help you find that information. So what is SHIIP? We do not sell insurance. We do not advocate for one insurance company over the other. Like I've said before, we do the neutral, objective, unbiased information on Medicare and long-term care insurance products. And any medical or financial information that people entrust to us is kept at highest confidence. We use that information, first of all, to help them find Medicare drug plans, as well as the financial component to see if they can qualify for any helps to pay for their Medicare products. We do have databases that we use to help find that information. It's not something we just come up with. We use these databases with their information to help them out. So that is basically what SHIIP does. And so what I'm going to do is I'm going to begin sharing my screen, and we have a PowerPoint that's only about 28 slides, but I will hopefully answer a lot of the questions that you guys have. Okay. Okay, perfect. So like I said, I'm Amanda. This is Anna over here with me. Anna is based at Rufty Holmes Senior Center. So, and we represent the North Carolina Department of Insurance. She is hired as the SHIIP coordinator, and I am a volunteer. So our goal today is going to talk about what is Medicare and who's eligible for that. Not everybody's eligible for Medicare, so we want to make sure we do that. We're going to talk about the 4 parts of Medicare. We're definitely going to talk about how people maybe with limited income and resources can qualify, and that's going to be our goal today, okay? So most of you would already know that Medicare is the federally sponsored individual health plan. So like say I'm married to someone, we have completely different Medicare type coverage. It's not something you have to do as a group, but rather everybody's individual. Most people see it as the red, white, and blue card. That's what they normally automatically think about. So when we're talking about Medicare, that gives you entrance into getting medical coverage for your necessary procedures and services. And then what will happen is once you get that red, white, and blue card, it's almost like a membership to say, we can then expand it out to give you more medical coverage, and we'll talk more about that. Medicare is not a free program because it does have some copays, co-insurance, deductibles, that type of thing. And that's where the secondary coverage comes in with Medicare that we'll talk about, okay? So here's the thing. Everybody does not always realize that you don't have to always be 65 to participate in the Medicare program. So if you are considered disabled by Social Security at 24 months, you're able to get a Medicare plan after that. But some people, they become disabled through Lou Gehrig's disease, end-stage renal disease, those types of things become available to have it. And then most people get it though when they turn 65. So there's 4 parts, and this is the way I try to explain it to people to help them out. So we have Part A, Part B, Part C, Part D. Looks very easy, right? So we got to look at it as parts. Part A is your hospital insurance. So let's think of a heart. If I'm having a heart attack starts with A, that's going to be our hospital coverage, right? But let's say that we have heartburn, not a heart attack, so that's B for burn. That would be medical insurance. So anything that's medically needed that's not hospital related would go under your Part B. There are some coverages that you would use your Part A hospitalization for that would look almost like that, like all of it's hospital. But let me give you an example of what I'm talking about. It may be that you go to the hospital for something and they say, oh, you're just under observation. So that may not necessarily jump into your Part A hospital insurance. So Part A hospital insurance would be more like the inpatient services. And there's a whole list of other things that go with the Part A that we can show you how to get to that. That's called the Medicare Basics form with the North Carolina Department of Insurance. They can explain all of that to you, but just as a bird's eye view, we're only taking a few minutes to explain some of this. So that's where we'll go from there. So if I get that coverage, it only covers a certain amount. So then we've got to figure out, are we going to get a Medicare Advantage plan, which is a private type plan that covers the Part A and Part B coverage, covers some more, and then you're responsible for co-pays. That would be the Part C, Medicare Advantage, okay? So if you can remember, Part C is a complete plan where it not only has your medical coverage and your hospital coverage, but at times it also has your drug coverage. So it's complete in the fact that you have your co-pays, you have your coverage with that, and it's all in one nice little compartment, okay? Other people will choose, while we're talking about that, to get on what's called a supplement. And what a supplement is through the government where it's standardized. So you may have heard those as like Plan G, or there used to be a Plan F or a Plan C. You may hear those letters go along with that. And what that standardized supplement means is they're going to cover the gap. It's also called Medigap insurance, of what your hospital coverage and your medical coverage do not cover, with the exception of drug coverage. So you have 2 options that you can do in that. And we'll talk about it a little bit more in detail later. But once you have your Part A and Part B, that's sort of like your membership into Medicare, you can choose to get an Advantage plan, or you can choose to get the supplement. And then after that, we need to make sure that you have the drug coverage. Some Advantage plans have the drug coverage, but supplements don't. So you'd have to get that, okay? So a lot of people want to say, well, what does original Medicare cover? So this is the list that you can find on the Medicare Basics form. But these, by the most part, is what Part A covers. And as you'll see, inpatient hospital coverage is the big one. Skilled nursing care in a facility requires the minimum of 3-day prior hospitalization. And let me explain that to you. A lot of times people get a little bit confused on this. I just had a conversation today with a professional who is over the age of 65 that was not aware of this. So this is very important for people to remember. When we're talking skilled nursing care, that's not a nursing home stay for a long term, okay? What that is I possibly fell and broke my hip and I need skilled nursing rehab, like the physical therapy. I may go into a place that people would call a nursing home, but I'm there for rehab, and that's where that payment comes from, okay? Now let's say that I'm diagnosed with dementia, or I'm physically unable to take care of myself any longer and I require stay into a nursing home. This is not what Part A covers. That's where the long-term care insurance piece jumps into that. But Part A is just for rehab, if that makes sense. And then if we look at the Part B, that's more like the physician services or outpatient services. So let's talk about that for just a second. Let's say that you decide you just want to do Part A and Part B, and it says, well, the following services are covered at 80%. A doctor's office visit might be $100, and you're like, well, I only have to pay 20% of that. That's good. So that's like $20, right? And it may sound good, but let's just say that same physician says, you're going to have outpatient surgery for your knee. You're having some trouble with it. And then you find out that that surgery, along with whatever else they're going to do, is $10,000. Well, you think 20% at that point, that's going to be a lot of money. So if all we had is the Part A and Part B, we know we've got to find some other way to fill in that gap. And that's where that Plan C or Part C, Medicare Advantage Plan, or the supplement comes in, because it helps fill in that gap. Okay. A lot of times people are saying, well, what isn't covered by original Medicare? So if you're doing some outpatient prescription medications, that's not going to be the case. So that's where the drug plan would come in. Dental, vision, glasses, hearing aids are not covered by original Medicare or a supplement. Those are sometimes covered by your Medicare Advantage plan, okay? Foreign travel is not. Let's say you want to do some cosmetic procedures that are not necessary. Those are not going to be covered. And long-term care, just like we spoke about, the skilled nursing for rehab, absolutely it does cover, but the long-term care, it does not. So most people can get their Part A free as long as they've worked some quarters, and Social Security can get into the weeds with that. But basically, if you don't, there are people that can qualify, but they would have to have a premium that they would pay. I won't spend a lot of time on that because most people have the 40 quarters and that's not an issue. But if not, then that's where Social Security would get into that. Now, Part B is the monthly premium. So just like I said, we kind of get membership into the club of Medicare. So we've got the Part A and we've got the Part B. So when we get our Social Security check, Social Security immediately deducts that Part B premium out when we're signed up for Part B. It seems a little ironic that you would think that you would sign up for Part B with Medicare, right? But that's not the case. You sign up with it through Social Security. And so the standard payment for Part B right now is $144.60. They'll take that out of the Social Security check if you're receiving Social Security at that time. The exception to that is if you qualify for a low income type subsidy, which would be determined with an application, and that's where SHIIP comes in, where we can help assess that, along with DSS can assess that, Social Security can assess that. Or let's say that you make a lot of money, your premium for Part B may be higher. So by and far, most people would be under the standard, but if you're lower income or your higher income, that amount would be different. Now, let's just say that you are someone like my mom who signed up for her Social Security early. She decided to take early retirement. So she took early retirement. She got a notice saying, you're automatically enrolled in Part B. Some people don't want that because they still have their employer coverage. So what they do is they opt out of it. Okay, you can decline to do that, but the coverage, if you sign up for it, will begin the first day of the month, unless your birthday is the first of the month, and then it's the first of next month. That's a little tricky on that, but by and far, most people would be the first day of the month. I love this chart because it's a good visual. A lot of times you'll hear people say, well, I've got to sign up for Medicare in around 6 months is what they say. But if you're turning 65 and you're not collecting Social Security, this is your initial enrollment period, and you've got to keep this in your mind. So there's a 7-month period. So let's use this month. So my birthday is in September. So what I would need to do is I would need to look 3 months back. So that would be August, July, June. And somewhere in that time, I can start saying, I want Medicare, but it would not start until the first of the month when I've turned 65. Now, you also have the ability to start it and say, I want to start it on my birthday, I call and say, all right, I'm ready for Medicare. It won't be effective September 1st, though. It would be after that. It would be delayed. And I could still sign up for October, November, December, if that makes sense. And it would be delayed. It would not go back to September 1st. But based on when you sign up for it during that 7-month window would depend on when you get it. I tell every one of my people, if you need medical coverage, you need to start talking to me the 3 months before you turn 65 so we can go ahead and get it done. I've always been one of those people to say, if you fail to plan, you plan to fail. So let's get it done sooner rather than later. So let's just say that you say, I don't think I want to sign up for that. It's not on my priority right now. Well, if that's the case, and let's just say you decide not to sign up for it and your birthday's in March and then you're at July 1st and you're like, well, I didn't. You would have to wait until the next year between January 1st and March 31st to start on it. And there would be a penalty for your Part B if you didn't. So let's not do that. If you don't have coverage through an employer plan or some other plan, let's get it started when you're supposed to, and we'll help you do that through SHIIP. Now, there are some special enrollment periods. So my mom, for example, she got her early Social Security at 62. She had her employer plan, and now she's decided that she's going to retire. She's past the open enrollment period, or initial enrollment period, I'm sorry. She's ready to get it. So her special enrollment period is, I've stopped my job. I'm going to lose my employer coverage. Now I need to sign up for Medicare. And that's completely fine. As long as she's had active coverage and it meets the criteria, there wouldn't be a penalty for her because it's a special circumstance. So there are some exceptions to that. For example, loss of employer coverage. You sign up for Part B and D as soon as you can, but you do have an 8-month special enrollment period. But the sooner you sign up for it, the better off you are, because you never know when you might need that Part B coverage. And then you'll have your Medigap open enrollment, which, if you'll remember, that's your supplement open enrollment period. Now, Part D, you only have 63 days. So if I start today and it's September 1st and I say, oh, I'm not ready to sign up for Part D, well, you kind of need to do it 63 days at least by November 3rd or thereabouts to do it. And it will begin the first month following the month you enroll. So how do you enroll? This is typically how you do the Medicare enrollment. And like I said, it's handled by Social Security. And this is normally how you would do it. You would log in and that type of thing. But COVID has changed all kinds of things. So let's talk about COVID. The Social Security office are closed for face-to-face. So Medicare Part A only beneficiaries can fax their Part B applications. And you would need to include your proofs of the 40B and L564 with your fax. I know that sounds complicated. It's not something I expect you to remember. If you get into that situation, you're welcome to call Social Security. They can tell you, or we can guide you through SHIIP. So we've danced around Medicare supplements just a little bit, and those are called the Medigap plans. If you'll remember, I said we have that Part A and Part B, and there's this gap of amounts of money that you'd have to pay. So for example, if you use your hospital coverage and you have to go in, there's a deductible of $1,408 this year. And that's only for a 60-day benefit period. So if we're talking for a full year and you decide every 60 days I'm going into the hospital, there's the potential of you paying that Part A premium or deductible, of $1,408. That could get very expensive. So that's where that Medigap or the Part C or Advantage plan comes into play. You choose one of those two. So let's talk about the supplement. If you remember, I said they're standardized. So what that means is if I sign up for, say, for example, Plan G, my Plan G is going to look the same from one company to another. Let's say Anna and I are sitting there eating lunch one day and she says, well, I'm on a Plan G. And I say, well, gosh, I'm on a Plan G too. I don't know exactly what kind of coverage she has because they're all standardized, okay? I'm not sure how the government came up with the idea to call Part A and Part B and then have supplements called plans, but you've got your Part A and Part B, that's the red, white, and blue card. The supplements are called plans. And yes, there is a Plan A and a Plan B, and it goes through and some letters are missed. But just know that if somebody says, I am on a plan, fill in the letter, and it's a Medigap plan, you can look at a chart and it will show you exactly what's covered. Plan G is the one that has most coverage of any of them. The only thing it doesn't cover medically that's covered by Medicare is the Part B as in boy deductible. And this year, that deductible is $198, and that changes every year. So basically what that means is if you have that coverage and you go to the hospital, they say, don't worry about it, Mr. Smith, you're covered. You don't have to worry about that Part A deductible. If you go to the doctor or have outpatient for one time for the year, you would pay that deductible, and then the rest of your services would be covered. And then if you'll remember, the drug coverage is not part of the supplement. You would have to get your drug plan, okay? But we have a chart on our Medicare Basics form that explains that perfectly. So if anybody needs help with understanding that, we're happy to do that. There's some people that will not get Medicare coverage through, say, a supplement or an Advantage plan. For example, if somebody's really low income and they approved for Medicaid, there would be not a reason for them to sign up for a supplement plan, for example. If they get TRICARE because they're a military family, that's considered a coverage that's available to them. And some people have great employer group health plans that keep them on that, and that's fine. We just want to make sure if somebody's becoming new to Medicare that they have ample coverage for what they need, and they have the choice to do that or not. This is a very detailed slide, but I'm going to just say every employer group health plan is different. There's no way to judge just based on one slide. Now, if you remember, we've talked about the supplement, which was those plan A through N with some of the letters missing. You remember I said Part C is the Medicare Advantage plan. It's complete in that it has the medical coverage, the hospital coverage, and if you need drug coverage, it has the drug coverage based on what plan you choose. And then C stands for copays. You'll have copays for those. So if you go to the doctor, there may be a copay. You go to the hospital, it may be a copay. You have certain things like that. But that's just another way for you to get your Medicare coverage. It's all run by private companies. You get one card, and that's how that determines on what your copays are. Every one of them are different. So each year we have to check, are people in network with their doctor or out of network? Are they, what are the copays going to be, and that kind of thing. The way people determine if they want a Medicare Advantage plan or a supplement is this: it's their preference. The supplements do have a higher premium, but then at the end of the day, they may not have to pay copays, or they don't pay copays for certain things. They just have the deductible or whatever their plan does not cover. The Advantage plan, usually they're free or very low cost, but then in exchange for that, you have the copays when you go places, say the doctor, the hospital, and that type of thing. So it depends on how they want to get coverage. And if you'll remember, I said it's individual. So my mom and dad, my dad is a supplement or bust. He's going to be on a supplement. My mom signed up for an Advantage plan because she liked the idea of not paying that premium each month, but she has copays. The thing with Advantage plans is you've got to make sure your doctors are covered. If they're not, there's a potential that either with an HMO, you can't see that doctor without you paying all of the cost, or if you have a PPO, you may have a higher cost. So in the types of plans, they vary from county to county. So what it might be for one person may not be for the other. Typically, you sign up for that between October 15th and December 7th, but there is now an enrollment period of January 1st to March 31st of each year if you want to change that. Just like I just said, October 15th through December 7th. Original Medicare, I've kind of talked about that. As long as Medicare is covered by a doctor's office and that type of thing, with original Medicare, you can go. But with Advantage plans, there are certain networks of doctors and hospitals you have to use. But both of those require you to still pay that Part B premium. That's part of the membership into Medicare, so to speak. So everybody's going to be paying that $144.60 premium for that through their Social Security. for any plan that they choose, because if they're on Part B, they have to pay that. I will say that Advantage plans, and I brought this up a little bit, sometimes they do have the extra benefits of vision, dental, and hearing. But like I've said before, every Advantage plan is different on what it looks like. So that would be something you would individually look at through a SHIIP counselor or someone who's educated on those types of plans, so that they can show you what is covered and what is not covered. So Part D, if you can remember, D stands for drugs. That's what Part D is, okay? So anybody that's covered by Medicare Part A or Part B or both is eligible to join the Part D plan. These are all change every year from October 15th to December 7th when you enroll in them. And they're formularies, which means the types of drugs that are covered by the drug plan and that type of thing. They're all run by private insurance companies. And each one of them have co-payments for their medications. Some have a deductible that you have to do and that type of thing. And every year that they change. And at the end, I will show you what a donut hole is, because a lot of people hear Part D, they think of another D word, donut hole, and they want to know what that is. Now, some people will qualify for extra help to pay for their Part D as in David or drug, period, and they're planned. And that is something that's determined by Social Security Administration. There are some income guidelines for that we can help people do extra help applications. It's a very simple application, but sometimes it can be a lifesaver for people to be able to afford their drugs. So each year you can enroll in your drug plan, and you look at it each year from October 15th and December 7th. And if you'll remember that 7-month initial enrollment period, 3 months before, 3 months after your birthday, and the month you turn 65, that would be when your initial enrollment period is. And you may be able to join other times, but that is a little bit more detailed, and we can talk to you about that if you need it. So we've talked a little bit about the Advantage plan difference from the Medigap plans. I've kind of belabored that a little bit, but if you need to know more information about that, we can certainly, there's booklets out there that are offered through the Department of Insurance, as well as we can sit down and talk to you about those to see which one would be right in your circumstance. So this is the best slide. If you can remember anything, this helps you show how you can get your Medicare. So the Part A and Part B is your membership, right? And then you add a supplement, and then your Part D. If you decide to go with an Advantage plan, you still pay that Part B premium, but what it does is you get a card with the Advantage plan that combines that Part A and Part B. Okay, and then if you need the drug coverage, it goes along with it. So it's your choice. You have the freedom to choose which way you want to do it, and then we help you make it happen if that's what you want. So there's help out there. Do not go at this alone. You can reach out to myself or Anna. You can call the Social Security Administration about applying for the Medicare. And if you have any Medicare coverage questions, Medicare is out there. Do not try to feel like you've got to go at this alone. We are here to help you. And we'll certainly do whatever we can with that, okay? So here's the donut hole. A lot of people are confused about that, and I'm going to try my best to explain this to you. It used to be a lot more complicated than this. So this is the 2020 time. So every plan has the option of having a deductible. So let's just pretend you're on a drug plan that says they have a $445 deductible. That's the highest that it's been this year, okay? So for example, you see the total retail drug cost is up to $445. That's in black, and we're at stage 1. So I go to the pharmacy and I'm on all these expensive medications. The first $445 is my responsibility, okay? And once I get to that point, then I go to stage 2 of initial coverage. And what that means is once my drug cost goes between $445.01 up to $4,130, that combined amount, I'm paying my copays and what's required of me through my insurance company. And as soon as I hit the dollar figure of $4,130, I jump into the donut hole. And what that means is you're going to have to pay a certain amount of your brand name and generic medicines until you get to where you have paid a certain amount. The beautiful thing of this is that this is not something you have to keep up with. Your plan will keep up with this for you. When we do your SHIIP counseling with you, it will be out there for you. We will explain to you, if you come in here on October the 16th, we look at drug plans. If your drugs stay the same, we'll say, well, you'll be in your initial coverage until March, and then you'll go into the donut hole, and this is how much you'll pay. And after that, you'll be in catastrophic coverage. This has been a lot different this year, only because 2020 was the first year where the donut hole shrunk. So this is just a visual to try to help you. And it's so much easier when you have a real life situation. I only show you this just to try to help you give a visual, okay? As far as extra help, a lot of people wonder about what does extra help mean, okay? So there's different ways to receive extra help, and extra help can be for your drug plan. Medicare program pays for part of your Medicare premium for your drug plan. The drug plan may be waived. You may pay less for your drugs. But then the state with DSS assesses to see if they can qualify you for a Medicaid program that can pay for your Part B premium. The beautiful thing is none of us have to figure that out. That's the responsibility of Social Security and DSS to figure that out. But just to give you a visual of what some of the income guidelines are, if your income as an individual is less than $1,595 and your resources, which are your assets of liquid assets, are available for cash is $13,110, then it would behoove you to go ahead and apply for that. Married couples, the same thing, $2,155 combined, and the resources is $26,160. And then there are some saving programs that provide assistance with the Part A and Part B, and this is where that comes in. The best advice I can give you is, if in doubt, fill it out. Fill out that application through Social Security for extra help, and let them determine if it is something. It guides you through all the questions. The person would be able to give the information to fill out the form. If you need help with that, SHIIP will help with that as well. If you guys have any questions at all, I'm happy to answer those for you.
I mean, that was definitely a lot of good information. It can be a confusing, daunting task for individuals to look at. So we appreciate SHIIP being available and doing this presentation for everyone. And more information, the better. But there's like you said, there's always going to be help out there, whether it's through SHIIP or obviously we can guide and answer some questions as well, because it's, again, something that a lot of people have questions about. But I appreciate you spending your time this afternoon kind of going over this and giving us a good overview of the system. We usually like to do this in person, but obviously COVID's changed a lot of things, as you mentioned. So,
yes.
We look forward to hopefully getting together and doing more of these events in person.
We're here to help, and if there's anything that we can do, we're certainly available by appointment, telephone call. And Anna's getting on board real fast. She and I met yesterday. She was catching on very fast, and so I'm thankful that Rowan County is going to have her on our team.
We appreciate the time today.
Trent, thank you. Brandon, thank you.